from Physicians Clinic of Iowa joins us. I have the hiccups. I'm sorry, doctor. Joins us with details on a breakthrough treatment for those suffering with OSA. Thank you so much for joining us today.
Thank you so much for having me.
We really appreciate you being here because we were kind of chatting off air about sleep and how important it is. So, what are the signs and symptoms of obstructive sleep apnea?
We've all had sleepless nights, unfortunately, listening to spouses, parents, friends snoring most of the night. And I think that while snoring doesn't necessarily affect your health, it's obviously annoying if you have to listen to it, but it can be a sign of kind of a deeper, more significant health problem, which is obstructive sleep apnea. Now, obstructive sleep apnea is a condition where your airway, your throat kind of closes up at night and you stop breathing, causing the oxygen to go down in your body. Now, thanks to a lot of breakthroughs in how we understand the disease, we now know that it's associated with significant other health conditions called, you can have morning headache, you can just feel tired in the morning, obviously snoring, or just people watching you stop breathing, gasping for air. All of those can be potentially signs that you may suffer from sleep apnea.
Okay. And if you do it like maybe once in a while, that's okay, but it's when it's happening multiple times, is that correct?
Exactly. So we diagnose sleep apnea with a sleep study. Now that, thankfully, with, again, new technology can be done at home. And what we do is try to understand how many times an hour a patient stops breathing. So anything under 5 is considered normal for an adult, but then above that, there are certain severity ranges where, depending on how often you stop breathing, can mean that you have severe or mild sleep apnea.
Okay. And that can lead to a lot of other significant health
issues.
So it's something you want to treat and take care of.
Exactly. Mainly because the oxygen goes down so significantly at night, it can really cause premature wear and tear on your heart, on your brain. We know it's associated with dementia, heart attack, stroke. And so it's definitely something where it's more than just snoring. It's more than just having to listen to it. If you or your loved one suffer from it, definitely something you want to dig a little deeper and see if that might be going on.
Okay. And what are some of the treatment options for it?
So the mainline treatment, which has been around for 30 or 40 years, is the mask, CPAP. That can be basically either over the nose or over the face. It blows air into the throat to kind of keep it open. But many patients, unfortunately, because of many factors, can't tolerate that. Claustrophobia, they have issues. So what I offer at PCI and our group with the ENT group there are other surgical options. So Inspire, which many have heard of, is a surgical procedure which helps use the body's own muscles to keep the throat open at night. But there are other surgical treatments as well. We really focus on a personalized approach for patients, trying to understand why they have sleep apnea individually, what's going on in their throat, and then really make a personalized recommendation on what would be the best treatment option for them.
So it's important to get that individualized because one person may different from another person, but also I think sometimes sleeping with that mask on would be kind of a challenge.
Exactly. And I think, again, for the people who can use it, it's great. And some people, swear by it. I'll say,
I'm sure they do.
You can't take it away from me. And in those patients, we certainly want them to continue. But where there really has been a renaissance has been in the non-mask options in the last 5 or 10 years. Really a lot of different options are out there now. My job, hopefully today, but through other education and things that we do, is just educating people that if you've tried CPAP in the past, didn't work for you, it is important to know that there are other options. There are other things that we can help with, because we don't want people suffering, going living their lives with a potentially treatable disease. Now with some of the newer technology that we have, and at PCI we've developed really a center of excellence where we offer the widest range of options for sleep apnea and the highest volume of sleep apnea, really in the Midwest, but definitely probably in a handful of places in the country that offer as broad a treatment options as we do.
And then you have an event coming up where people can learn more about Inspire.
Absolutely.
Tell us about that.
Absolutely. So we have a virtual community health talk on December 12th, where it'll be 30 minutes of talking about a little bit more in depth about what Inspire is, how it works, kind of the risk benefits all around it, and then it's an open forum where people can get questions answered.
Okay.
And then if they would like to hear more, or potentially come in for a consult and talk more about it, then we're always available. PCI, we don't require a referral, so patients can call the PCI ENT clinic to schedule appointments. If they just want to chat, if they want to hear more about it, we're happy to help.
Okay. Thank you so much for being here today. Really appreciate it.
No problem.
And we will have all this information on our Facebook page so people can look it up and take care of it.
Thank
Because
you so much.
you need sleep.
Yes.
Yes, definitely.
Absolutely.